Welcome to the Illinois Perinatal Quality Collaborative Labor Management Support e-modules. These e-modules were made as a resource to support hospital implementation of the ILPQC Promoting Vaginal Birth, or PVB, initiative. The aim of the PVB initiative is for 70% of Illinois hospitals to be at or below the Healthy People 2030 goal of 23.6% cesarean delivery rate among NTSV, or nulliparous term singleton and vertex births, by December 31st, 2022. Our goals include increasing the percent of C-sections among NTSV births that meet ACOG SMFM criteria for cesarean, as well as educating physicians, midwives, and nurses on ACOG and SMFM criteria for cesarean, including labor management strategies. Hospital quality improvement teams participating in the PVB initiative are working on 5 key strategies to reduce cesareans among NTSV births, including labor management support. ILPQC partnered with Jessica Brumley, the co-creator of the Florida Perinatal Quality Collaborative, or FPQC, labor support workshops, completed by over 400 nurses and providers in Florida as part of FPQC's Promoting Primary Vaginal Deliveries, or PROVIDE initiative. Jessica is Director of Midwifery at the University of South Florida Department of Obstetrics and Gynecology, where she leads a team of 14 midwives and advanced practice nurses. She also serves as an advisor on the FPQC PROVIDE initiative. In August and September of 2021, Jessica and ILPQC worked together to offer 2 live virtual labor management support courses for nurses and providers in Illinois. These sessions were recorded and broken down by topic into this collection of 14 e-modules ranging from 6 to 21 minutes each. We are excited to share them with you. Now I will turn it over to Jessica.
Some of this is the same, some of it is totally different, but really trying to take the angle about what can we do to promote comfort, because not only does that help coping, but it helps that physiology, that hormonal physiology that we talked about all the way, in the beginning of this presentation. Excuse me. And we know, we all know, the answer to this question. An epidural is not the only option, and an epidural doesn't always help with with coping in labor, although it can help with pain. So we know that there are techniques such as education and support, oral hydration, position changes, non-pharmacologic techniques such as massage and water immersion that can all help with coping and comfort. And the ACOG committee opinion on approaches to limit intervention during labor and birth talks about many of these techniques. Acupuncture, massage, relaxation techniques, aromatherapy, TENS units, childbirth education, all are strategies that may help women cope with labor more than necessarily directly affect pain scores. And actually, the American College of Nurse Midwives has a bundle on promoting comfort in labor, and that can be a tool that you can use if you think this is something that your institution wants to work on. You can use this to to kind of go through the steps and think through this. So why comfort measures? Because it improves outcomes, and it is really a key component of continuous labor support. There is such a thing as the fear, tension, pain cycle. And so they kind of feed into each other. And so discomfort, tension, muscle fatigue, it leads to fear, anxiety, feeling unsafe and unsupported, which leads to fight or flight stress hormones, which lead to increased heart rate and respiration and a less effective labor. And then it just keeps kind of, continuing in a vicious cycle. So what we want to try and promote is this safety peace cycle, right? So a relaxed, comfortable environment that can lead to feeling safe and calm and confident, which can help to facilitate endogenous oxytocin and endorphins, which help to boost confidence, decrease pain, and lead to a more effective labor. So how can we do this? Creating a calm environment, and we can do this by dimming lights. I have the best views probably of any labor and delivery unit ever because we're right on the water in downtown Tampa. And so there are these big, huge windows, and you just look out onto the bay, and it's a really beautiful view. And so I am turning down lights in the rooms all the time and just use natural lighting in our rooms. And I think it feels really great. It's a way for me to create peaceful surroundings. You can play soft music, and you want to be sure that you create a sense of privacy. You may need to adjust the temperature, warm or cool temperature, depending on how hard she's working and feeling. You can use aromatherapy, really, it seems so basic, but respectful patient care, and as few disruptions as possible, right? Every time someone walks in the room, it can impede the sort of like the zone that women are trying to get into. And so you can use music. Therapeutic use of music can have a calming effect, and music activates the right brain that can effectively mediate pain. And the music selection should be based on what the woman finds relaxing and or comforting. So some research has found that soft music without lyrics during the active phase of labor significantly decrease the sensation of distress and pain. And so we should be encouraging families to bring the music of their choice. And honestly, these days, everybody walks around with a smartphone and has access to the internet or a music app, and probably have their own playlists of things that they enjoy listening to, and the speaker from your phone is probably enough, or use headphones. Sometimes that feels really good. We have these TVs with like music stations that we can go to, and even like naturescape stations. So sometimes we'll go there and just kind of like set the mood, right? Set a calming mood, in the room. And this can all help to facilitate coping. And there are the 3 R's of coping: relaxation, rhythm, and ritual. So they're able to relax during and or between contractions. That's a sign of coping. In early labor, relaxation during contractions is realistic, but as you progress into later labor, then it's probably only realistic to expect them to be able to relax in between contractions. And it may feel better to move or vocalize during contractions, or even tense parts of their body. And it's vital, however, that they relax and be calm between contractions. The use of rhythm characterizes an effective coping style. Many people will sort of like develop a habit that they do during each contraction. Rub here, push here, I'm going to lean forward. Ooh, lots of different sort of strategies to find that rhythm, and create ritual, right? So something sort of like repeated, that they can do with each contraction. And here are some examples of unplanned spontaneous rituals. So one woman felt safe and cared for when her mother brushed her long hair. Another rocked in a rocking chair in rhythm with her own pattern of breathing. Another dealt with her back pain by leaning on the bathroom sink, swaying rhythmically from side to side and moaning while her partner pressed on her lower back. So really, it can be kind of all over the place, whatever just feels good, and it may need to change depending on, the stage of labor, the intensity of the contractions. And so sometimes changing the ritual or disturbing it may totally throw her off. But if all of a sudden it was working and then it's not working, then that's usually a sign that we need to, do something differently. Aromatherapy can be used. It involves using essential oils by massaging them into the skin or inhaling the scents. And the oils are extracted from plants and distilled. And the purpose is to engage the senses and create a relaxing environment, reducing anxiety and fear. I am no aromatherapist, but I usually keep lavender and peppermint and some kind of citrus essential oil and in the hospital. And we usually just put it on a washcloth. So that way, if the patient doesn't like it, then we can totally remove it from the room. Some patients will bring it in themselves and have a diffuser, but you definitely want to be careful because some scents can be triggering. I think we, brought it into a workshop one time and somebody said that lavender triggered headaches for them. So, you want to be cautious, but it can really change the whole mood in the room and, the energy. Peppermint is good for nausea, but it also exhaustion. And citrus can bring energy to the room when people just kind of need a little pick me up.